The Chatty Dentist provides general advice and insights on patient communication in dentistry. However, we want to make it clear that we are not affiliated with any dental council or professional organization. The information shared in this podcast is for educational and informational purposes only. We want to emphasize that the content presented on the Chatty Dentist should not be considered as professional, specific, or personalized advice for individual cases. We do not make any guarantees or warranties regarding the accuracy, completeness, or applicability of the strategies discussed. It's important to note that the dental regulations, standards of practice, and professional guidelines may vary significantly by region. Therefore, listeners are strongly encouraged to consult with qualified professionals or relevant authorities in their respective areas for specific guidance tailored to their unique circumstances. By listening to the Chatty Dentist, you acknowledge and agree that the podcast hosts, guests, and producers bear no responsibility or liability for any actions taken or decisions made based on the information provided in the podcast. We disclaim all liability for any direct, indirect, incidental, consequential, or punitive damages arising out of your use or reliance on the podcast content. If you want to get in touch with us, please email us at ask@thechattydentist.com. We want to acknowledge the Burunong people of the Kulin Nation as the traditional custodians of the land we are speaking from. We want to recognize their continuing connection to land, waters, and culture and pay our respects to their elders, past, present, and emerging.
Miss Smith, a 24-year-old patient, is attending your clinic today complaining of pain and bleeding from her gums. She mentions that her problem has been occurring on and off for the past year and has gotten worse over the past 2 months. Medically, she is fit and healthy. She had a viral infection about 10 days ago. She went to the GP this morning and was prescribed penicillin but has not started taking them. You examined her and noticed ulcers around the margins of the gum. She smokes 12 cigarettes a day and takes alcohol once a day. She is a law student and has upcoming exams. Address the patient's concerns, explain the diagnosis and management.
The pointers here would be that we must focus on the diagnosis with emphasis on likely etiology. We must focus on stress management wherever relevant, and we also must educate the patient about immediate management for ANAG. Let's dive into the role play now. Hi, Miss Smith, you did really well while I was having a look at your teeth there. Are you okay so far?
Yes, just a little hurtful.
Yes, I can imagine it does look a little bit painful. I'll sit you up and we'll discuss about what we've seen today. Is that okay?
Yes, please. Go
All
ahead.
right. So what you have is necrotizing gingivitis. What that means is that your gums right now are very, very inflamed. They're very irritated at the moment, and there are many factors that's leading to it. So from the notes that I have with regards to your medical history, I can see that you don't have any medical problems, but you did recently suffer from some sort of a viral infection. Is that right?
Yes, I did go to the GP this morning as well regarding the same.
Oh, okay. But in the past, have you had any issues like this? Has this ever happened to you before?
No, the viral fever?
No, the gums, the problem with the gums.
No. This is the first time and it's quite painful, so I would remember.
Okay. And with regards to your past dental history as well, have you had anything done in the past? And do you have a regular dentist that you go to?
Not really. I'm just there's too many things happening in life for me to, have time to go to a dentist regularly.
Right. And I can see that you are a law student. And is that quite stressful at the moment?
Yes, quite stressful.
Okay. Well, also on your habits, I've noted that you've written down as smoking and you do also consume alcohol. Is that right?
Yes.
Okay. With regards to smoking, have you thought of considering cutting down on it or have you tried quitting smoking in the past?
In fact, I think I've increased the number of smokes I smoke every day.
No, I understand because you are in a very stressful course. Yeah. I completely agree with the stress bit of it, but smoking also does have an impact on our gum health, and given how severe your condition is today, it's best that we cut down on smoking, at least for the time being, until you feel better. Is that
Okay.
something that you'd be able to do?
I can try.
Okay. Yeah. So this sort of a condition usually occurs due to a variety of factors. So as we have discussed, health issues, it does not look like you have any, but it's a best idea to see your doctor once again and just make sure that they're running all the blood tests to make sure that you don't have any mineral or vitamin deficiencies or any other underlying causes there.
Okay.
The viral infection that you have mentioned, it's likely that sometimes it could have an oral presentation as well, which also
Okay.
looks like this. Again, we don't know if that is also a reason. Sometimes a drop in the immunity can lead to this condition.
Okay.
Smoking also can be a risk factor for poor maintenance of our gums. And the other thing that has historically shown to have worsened this situation is definitely stress.
Okay.
So stress management is also quite important, and I'm more than happy to provide you with some resources today in case you are wanting to seek further help.
Okay.
Is that something that you'd like me to do for you today?
Yeah. Yes, please. Why not?
Yeah, sure. This may not be entirely relevant, but do you have anyone in the family who probably also have, experienced something like that? The situation that you have, the gum issues that you had?
Not really.
Okay. So what we'll do today is first I will numb up the area where the gums are quite inflamed so that it will be a bit more comfortable for you. And then I'll give you a good clean. We'll just clean around wherever I can see that slough tissue around there. I took some pictures as well to show it to you.
Okay.
So we can just gently remove that bit, make it a bit more comfortable for you. And I'll also give you a mouthwash that you can take home with you today.
Okay.
I would recommend that you use it for the next few days, which also helps with containing the bacteria and also generally healing those gums around there.
Can you give me some of that numbing gel because it's quite hurtful and
Absolutely. Yes. I'll definitely do this as comfortably as possible for you. Now, I know that your doctor had given you some antibiotics. Is that right?
Yes, this morning, just before I came here.
Right. I will give you another set of antibiotics today, which is more effective in healing this condition. So I recommend that you take these antibiotics and probably not worry about the one that your GP had given. This is more specific to the condition, the gum condition that you have.
Okay.
So this is metronidazole, which you must take 2 times a day. It's 400 mg, and we will do a 3-day course for now.
Okay.
I would say that would suffice the requirement at this stage, and we'll bring you back in 3 days. Once you finish the course, I would like to review you within the next 3 days because I want to make sure that you're getting better.
Will it also help me with the viral infection that was shown, because of which I went to the GP?
Probably not, because viral diseases usually don't respond much to antibiotics.
Yeah. Okay.
Yeah, so and that's the reason why as much as I suspect that there could be a viral origin to this, but when I was examining your gums, I can definitely tell that there is a bacterial element to this as well.
Okay.
And that's the reason why I would say that this antibiotic is more suitable for treating this gum condition.
Okay, sure.
Yeah. I also do want to go over your oral hygiene practices today. I know that you're quite busy, you're stressed, there's a lot going on, but we must not forget the importance of how much our oral hygiene influences our gum health. So I definitely like to go over your brushing and flossing techniques with you today. I obviously don't want you to overdo anything for the next few days because it's quite painful. It looks quite swollen right now. We really need it to get better.
Yes.
But once we get that in order, I think we should also schedule regular visits for you to make sure that we are staying on top with your gum health and making sure that this does not happen again.
Okay.
Is that all clear so far, Miss Smith?
Yes. I will definitely try to follow what you say.
Definitely. That's really good. But I do also want to just give you a heads up. if you experience any worsening of symptoms, and especially after hours, that is, any high fever, swelling, difficulty breathing, difficulty swallowing, any other signs of infection spreading into the body, I would definitely urge you to go to the emergency department as soon as you can. All right. And once I've reviewed you in the next 3 days, I just need to make sure that everything is resolving and healing within the next 2 weeks.
Okay.
But if this problem continues to exist even after the next 2 weeks, then we must consider referring you to see a specialist.
Okay. No, let's not get there. Let's try to
absolutely
do it ourselves.
Usually it should get better with all the measures that we're doing so far. So because from my end, I'll be cleaning it and I'll be giving you the mouthwash and the antibiotics. From your end, we just need to control all those risk factors, just as we had discussed earlier about stress, about smoking, and just maintaining good oral hygiene.
Okay.
Is that all clear so far, Ms. Smith?
Yes, it's all clear.
That's good. Are you okay for us to proceed with
Yes.
the cleaning today?
Sure.
Okay, good.